one size fits all diet. And I learned as soon as I graduated and started to try to help people and guide them on this meal plan that seemed to be perfect for everyone, I learned that it wasn't, that there were just so many people who it wasn't helping. Their blood sugar was not getting controlled. They weren't feeling better. And I blamed myself. I thought, I must have not learned this well enough, and this is my fault. And I even left the career for a little while because I felt so frustrated by it. Finally, my husband was diagnosed with an autoimmune condition called Graves' disease. And I thought, gosh, as a dietitian, I feel like I should have some advice for you. I feel like there's something we can do with food that could help, but I've never learned this and I had no idea what to tell him. So I went back to school to learn and study, and that's where I was lucky enough to meet you. And together we studied human nutrition and functional medicine, which really opened my eyes to just so many new concepts and the idea of root cause medicine and, understanding, underlying imbalances and, using food to restore good health, and then, and not really just treating symptoms, but really addressing the root cause. So I graduated from there and thought, okay, now I'm good. I think I know what I need to know. And I also, again, tried to start helping people and felt frustrated again. It was because I think that in the beginning, I was so focused on just gut health and just removing food sensitivities. And that was great. And that's important. And I still do all those things. However, it's not the entire picture. When I started to really think about all of my patients and what they all had in common, it was inflammation. There is an immune response. Every time we feel something uncomfortable, every time we are diagnosed with a condition, there's an immune response is taking place, which is causing us to feel uncomfortable. Immune cells are actually responsible for pain and signaling to our body to give us this feeling of pain. And so that's why it's most important that we listen to these symptoms and we understand where and why we're having that type of immune response. And if we can address that, then we're making a lot more progress. We're not going to just reach sort of this midpoint of feeling better where we feel a little bit better, but we're not all the way there. If we can really address inflammation appropriately, then I really believe we can feel all the way better. So that's kind of my motto is let's just get all the way there,
Yeah, no, I love that. And like you said, so often I feel like people focus on just gut health and they kind of forget that the immune system is playing a huge role in that. And, immune system in general, I feel like for most people and clients and patients, the only time they think about it is when they're really sick, right? So it's never thinking about that chronic inflammation that so many people have, especially in this country with our diets and our lifestyle. It's so common, and it really is the root cause of pretty much all chronic disease. So it makes so much sense that you narrowed your scope to really focus on that. And, that's amazing. I remember in our functional medicine program, learning all about immunology with Dr. Heather Zwicky, who's just amazing. That was yes. Opening class and learning about autoimmunity and all of the dietary and lifestyle factors that go into that, because autoimmunity is exploding, especially for women. But so I love that you're honing in on this topic and you're so knowledgeable. But I'd love for you to explain for people just what is inflammation, because it's a word that people throw around and I think a lot of confusion exists around it. But can you just simplify it for us a bit and explain what it actually is?
Absolutely. Yes. Thank you for that question. So, we're all very familiar with external inflammation. So we get hurt, you get an injury on your elbow and you see redness and it gets hot and you feel pain and swelling. And what is happening is your immune system is reacting to this injury. It is sending out immune cells to that area. And that's why there's some swelling, the cells are becoming more permeable to these immune cells. the skin cells, they are on your, elbow. They are becoming more permeable to immune cells in your body, which is also making it more permeable to water. So that's why the area is swelling and it's turning red and it's feeling pain. Pain is coming from those immune cells that are signaling to your body to create a feeling of pain. And so this is all very familiar to us when we see this on the outside of our body. Now, the issue is that this happens on the inside of the body all the time. There's small little injuries taking place. Or there even could be an immune reaction, not to necessarily a physical injury, but also an imbalance. If your body is missing a certain nutrient that it needs, the body, it's not going to be able to function appropriately, and the immune system gets triggered. Or if you eat a food that your body reacts to, and it's an intolerant, not a food that you're sensitive to, again, your immune system is going to be triggered. Your body's going to say, oops, something's not right over here. We don't like this food. And your immune cells are going to be triggered. They're going to move to a specific area in the gut or wherever that undigested food is. And that's going to signal an immune reaction. So anytime your immune system is triggered, which is anytime there's an imbalance or an injury, that is going to be inflammation. And the more that sometimes that inflammation can go ongoing, without us even knowing, because it's internal, we don't see it. Maybe it's the slightest of a feeling that we have, but it's not a strong enough pain or discomfort for us to truly react. And so this little inflammation just keeps going and it keeps going and it keeps going. And over time, it causes more and more damage to the body. Inflammation actually is connected to dysregulated blood sugar or to not getting adequate sleep at night. If your immune system is reacting enough that you're feeling more anxious and you're having insomnia, then that inflammation doesn't get cleared because we're not sleeping well at night. There's just so many things that inflammation plays a role in, and over time, it just eventually leads to bigger and bigger issues. So I really do think that if we can figure out what is the trigger for a person's inflammatory process and their inflammation, then that is one of the first steps in addressing their health and helping them to feel better.
What are some of the misconceptions about our immune system and how people actually address inflammation?
Yeah, for sure. I do like this topic too, because I do think that many people feel that the immune response is one thing. And, when you have inflammation, it's just this one big thing that will just throw, curcumin at, or fish oil, or certain bifidobacteria, probiotics, and these things that are just considered to be anti-inflammatories. So you feel like this inflammation is there, it's this one thing, and then you just treat it with this other one thing. And that is just completely not the case. The inflammation is a series of multiple things. We actually have cells that are responsible for initially recognizing a threat, and then those cells will call in for help from other cells, and then more and more immune cells will move to the area, and some immune cells will want to fight off this threat really powerfully. Some immune cells will just say, let's just do this more slowly, and we'll use some mucus and histamine. And then we even have immune cells that are responsible for ending the inflammatory process and saying, okay, we had enough, no more inflammation. So, and it's so important as clinicians to understand at what part of the inflammatory process is somebody in this moment. Because if we just immediately assume they're in this height of inflammation and we just need to send out, curcumin to stop the inflammation, that's one possibility. That is a possibility. It is something, I'm not saying that we can never use curcumin, because these things are helpful in certain circumstances. But what if a person is at the end or at a part of their inflammatory process where their immune cells have those cells that are responsible for ending the inflammation? What if those cells are doing their job right now? what if those cells are out there saying, okay, it's time to end this inflammation, and then we send in more curcumin. And what if that person still has an infection? What if that person still has damaged tissue that needs to be cleared out? And now we are telling the body to just completely end this inflammatory process. It's too soon. The infection hasn't been healed yet, or the damaged tissue has not been cleared away yet. So it's not appropriate for us to just assume that inflammation is this one thing and we can always just use this one herbal remedy to fix it. We really have to understand where in the process this person is and how should we appropriately address it.
Do you have like a step-by-step process that you bring people through in the course? And can you talk a bit more about what that course entails?
Yeah, absolutely. So the course is an 8-week process, and each week I have pre-recorded videos that include either slide decks where I give lectures, or other videos where I'm standing at the whiteboard and literally teaching, kind of old school way of teaching. And and I always include a case study, because I really want that to make sure that the information that we're talking about and that I'm teaching is applicable in real life case scenarios to dietitians and nutritionists who are treating patients with all kinds of inflammation. So that is weekly, pre-recorded. There's about an hour's worth of video watching that's already pre-recorded. And then each week on Wednesday night at 6 p.m. Eastern Standard Time, there will be a live question and answer session. And that is for us to not only review the week's content, but also they're themed question and answer sessions, because I'm just trying to pack in seriously as much information as I could in these 8 weeks. And I found that if I can also do a little extra teaching on those Wednesday nights, that I can really touch on so many more conditions and processes. So each week, like one week it might be thyroid health. One week it may be adrenal health. Sometimes it might be a cancer session. But I really do want to, just try to get a different topic in each week. So we'll go through questions, case studies, and even a little bit of teaching on those Wednesday nights. And those are also recorded and available for students to watch if they're not able to attend live. So that is sort of the setup of the course. But to answer your question, the step-by-step process that I'm going to be teaching people is, well, first of all, I really go back to the basics of immunology, and I go through all the different cells of the adaptive and the innate immune system, where and when they are acting, how to even analyze routine blood work to understand kind of where somebody's immune system is balanced, how it's balanced, and how we could impact it by using food and lifestyle and sometimes supplements. And then we get into like the T and B cells from the adaptive immune system and a T cell polarization, and how, we could be maybe dominant in one type of T cell versus another and all that. So we really do, this deep dive in immunology. But my step-by-step process in addressing inflammation is not only understanding and assessing where a person is at and how to kind of rebalance. So sometimes we actually have to promote inflammation. So sometimes, like before I was saying, where curcumin might not be appropriate, sometimes we actually have to give herbal remedies that push the immune system even more powerfully so that it can clear out an infection or clear out damaged tissues. So that's number one. Step one is understanding, assessing their immune system and helping along the process that they need. But then the next step is to heal whatever tissue was damaged in that inflammatory process. So as an example, if you have somebody, and I use this example a lot because this is kind of how, when I first started creating my course, I was really focused on this one autoimmune condition called IgA nephropathy. which is an autoimmune condition that affects the kidney. So the first step in helping somebody with that autoimmune condition is to rebalance that immune system the way that I just mentioned, that first step. But the second step then is to heal the kidney. You have to heal that damaged tissue so that it can function better. So where in someone who has Hashimoto's, maybe we have to rebalance the immune system, and then we have to make sure that the thyroid has what it needs to function appropriately. So there's always this like sort of two-step process here where we address the immune system, we heal the tissue, and then we promote overall wellness and keep this person managed. It's not always about autoimmunity, but in the case of autoimmunity, you'll always have that autoimmune condition. It doesn't go away, but the idea is to keep it managed. And so after the first step and the second step, healing and all this is done, then we have to keep them at a managed level. So what I mean by that is we are avoiding flares of their autoimmunity, and that's helpful and necessary to keep them managed long term. But what's also necessary is to understand how are we going to address them when they do have a flare, because that's almost impossible to avoid for the rest of your life. There's going to be times where you get an infection or you have a huge stress, unfortunately, in your life, and it triggers a flare. So now as we learn this person, we can really understand what it took to balance their immune system the first time, what it took to heal the tissue, and now what is it going to take to keep them at a managed level for years and years to come, and then what does this person have to have in their toolbox so that when they have a flare, they know exactly what they need to do. So that's kind of the step-by-step process that I go through in my course.
Amazing. I know you have put so much into this. Really so valuable, and any nutritionist or dietitian would get so much out of this. And just, the end goal is to help our clients and our patients more. And I just feel like this is so valuable. There's so much information you're providing. You have the recorded sessions, which is great if you can't make it live, but you'll also have the Q&As. And I know you're stuffing so much information in, which is great, because as we've been talking about, like, the immune system is complex and that can feel really overwhelming for clinicians. So I just love how you break things down really simply, make it easy to understand, and then, have clinical pearls that you're giving people. You have the case studies so people can, use that information in their own practice